as we see more nations like Singapore kind of decide to live with COVID, I have to wonder, do you think the science is done?
The science is definitely not complete. I mean, we're still looking for a vaccine that will prevent transmission. And so as long as we don't have that, then we're going to have to figure out other ways. And we know the vaccines work to reduce severe infections, hospitalization, and death. But people are still being hospitalized. And in ever increasing numbers, a good proportion of them are vaccinated. Now, they'll do well, hopefully. And we have new drugs that may make their outcomes even better. Drugs that will reduce the risk of death. But it's a number of things that have to be used together. It's not only vaccines, it's about keeping distance, wearing masks, and the new drugs and treatment, and keeping people who are infected isolated. And no one has the magic formula yet.
You talk about new drugs. We also have that new Pfizer pill. How much of a game changer is it? And what do scientists still want to know about it?
And so both the Pfizer pill and the new drug from Merck have the ability to decrease hospitalization and death in people with mild infection. Now, they didn't really study them in people who had been vaccinated and developed mild infection. So again, we don't have that particular piece of information. But what we do know is that, so if you're vaccinated, if you develop an infection and you develop mild symptoms, you take the medication and likely, because we don't actually have that piece of data, your risk of hospitalization and death is lowered. So now we have an effective vaccine, and we have a way to treat people who have breakthrough infections. And so we should really be able to significantly impact mortality from COVID-19, which is the goal. Reduce morbidity and mortality from COVID-19. Whether this will allow additional countries to open up, it's not clear.
Jerome, you've been talking about when it comes to vaccine distributions. COVAX had a quite ambitious target about delivering 2 billion doses to developing countries, and they're still way off mark right now. What went wrong, do you think?
Yeah, COVID was a very ambitious effort. And, the world had to turn around and support it, and had to support it multilaterally, because this isn't something that a single nation can do. And, to some extent, we failed to provide COVAX with the support that it needed and the leadership that it needed in order to accomplish its mission. We needed to give them the authority, and we really didn't. And so whether it was, delay in the application of funding, difficulty negotiating long-term contracts with different drug manufacturers, there are a lot of different reasons. And it remains the case that, the majority of vaccines, yes.
Quickly, booster shots. Singapore started giving booster shots. How long will they last?
We don't know. Possibly 6 to 8 months, potentially longer. When we use booster shots with other diseases, sometimes that late dose, the 6-month dose, allows immune responses to be prolonged. So maybe 6 to 12 months. But again, we don't have the data yet.